Joe, the governor is putting this money, Medicaid expansion money, in his budget. What happens to it now? What's the process?
Well, it goes to the House first. The House, State House, basically the legislature draws up its own budget. It will look to see what the governor has and may borrow and may not borrow. The assumption is that in the case of the Medicaid money that's going to be included in the budget, which is all federal, is that they'll ignore it. That as the legislature puts together their own budget, it won't be in there. Now, but there is some fallout because there's some medical expenses, medical spending that is always been in the state budget, such as the federal money that goes to help pay for people who show up with uninsured, and that's supposed to be phased out. So there's some money that traditionally has been in the state budget or assumed to be money that the state budget can rely on that won't be there. So I think it will prompt more discussion than some of the Republican legislators had expected because he put it in the budget. And I think that's why he did it, was to force people to talk about it, even if they don't want to do it.
And from a micro level, the challenge that the governor and his allies in the medical provider community have is just the composition of the legislature, not only because it's Republican, but because a lot of the Republicans in there kind of have these scars from this earlier Medicaid battle in 2005 when they cut the eligibility to Medicaid down to its lowest level.
Well, it's down to the federal minimum.
Which is 18%. So,
for some.
Yes, for like a family of two, they would have to be making $2,700 a year in order to qualify for Medicaid.
And does that work against them, or is that a point of pride for a lot of Republicans that they've been that tough on the budget?
That's the point, because see, one of the reasons they had to make the eligibility standard so low was that in 2005 they were saying it was costing too much. Well, in order to save a certain amount of state money, because basically we get $2 federal for every dollar that we spend on Medicaid. So when they cut, then that means they were also losing all this federal money. So then they had to cut more to compensate for the fact that they were losing more federal money. So it became this catch-22. One of the reasons they got down to the minimum was that they had to compensate for the fact that they were losing all this federal money by making these cuts. I mean, they cut 300,000 people either lost some or all of their benefits back in 2005. And this was done, frankly, to save less than $300 million a year in state money. But they lost over $600 million in federal money, and then they had to compensate for that because that money kind of covered some other stuff. There's, as in any budget, there's different things that cover different things. And so there was a lot of fallout from that. So yeah, they felt a lot of scars from that, and they don't want to revisit it.
And whether you agree or disagree or not with that move, and that move was extremely controversial at the time, it still showcases the challenge. There might be some people who voted to make those cuts in 2005, especially in the Senate, who could possibly reverse course, especially if they're in a rural area that could be affected by the fact that this Medicaid expansion might not happen. But even if that happens, you have to get to 18 votes in the Senate, and you would have to convince people who are so adamant against it that they would filibuster, i.e. talk the bill to death, to sit down. It's a challenge. It's not necessarily a challenge that is impossible to overcome, but it's not going to be an easy path.
Yeah, because see, one of the things the hospitals are telling legislators, I think some legislators, because of term limits, many of the legislators from 2005 aren't there. But the people who are there now know that their predecessor had done this, is that many of the rural hospitals, as well as the urban, but it has a bigger effect in rural Missouri, will be losing federal money that they get directly for treating people who show up in the emergency room and don't have health insurance. That's supposed to go away with whether or not the expansion takes place. That money is to go away.
Yeah, because it would seem to me that there's a lot of opposition from rural legislators regarding certain budget factors, but has these medical issues really hit home for these legislators yet?
I think only when there's a couple hospitals who either are closing or close to closing in rural Missouri, and then there's an outcry, that then you'll see people look at it differently. I'm not advocating for or against. I'm just talking about the reality of the situation.
And again, this isn't, you guys don't see this as a one-session issue necessarily.
No, but this is an odd election year, as I've mentioned before. This is a year when there's no statewide elections. So often, the year where there's no statewide elections are when legislatures, just in Congress, as in Congress, tackle some of these complicated issues because the next year is an election year, and then they're more sensitive to what the public's saying. So any controversial actions, they'll try to get a lot of that done this year, or at least lay the groundwork for final action next year. Wouldn't you say that?
I would say so. Would you say so, Chris? What's your thought?
I would agree, but this Medicaid expansion would be a huge change for Missouri because, like we talked about earlier, we're currently at the federal minimum. We would have to go from 18% to 133%, and that would be a change of from 2,700 to 20,000.
I think it might even be 138 because of some
the federal
technicality.
poverty
Right,
level
but I
is what
mean-
we're talking about.
Right.
But the number
For the
usually
federal
voted
poverty.
is 133.
Right.
But I would agree it would be a big change. It'd be a big policy change. But there's a lot of consequences to doing it. There's a lot of consequences to not doing it.
But
I know
the medical, the healthcare business, that's a pretty powerful lobby in Jeff City, isn't it?
Yeah, but the Chamber of Commerce, which has come out in favor of the expansion, though, when they put out their priority list a couple weeks ago, big press release, 4 or 5 pages. I wrote about it. Other press reporters wrote about it. Medicaid expansion was not listed.
Even though they're in favor of it.
Right. They had other things that they were, in other words, there's other things that are bigger priorities. So you're not sure how hard they're going to push for it. And it's because of the controversial nature of it. Because many Republicans philosophically oppose this, aside from the money issue. They don't believe the federal government should be spending all this money on this. They don't think the federal government has the money to do it. And they don't buy the argument that it saves money in the long run. They don't necessarily agree with that. But aside from that,
no Republican wants to be primaried out by saying we implemented a form
Right.
of Obamacare.
right.
That's nobody in
Because,
Nobody-
right,
no
part of it's
Republican
because of the Obamacare thing, but it's also because philosophically, many Republicans believe that the government should not be that involved in health care, period.
let's give one example. Rob Schaff of St. Joseph. He's a physician. He's the only physician in the Missouri Senate. And he ran in a primary in 2010 where the Missouri Hospital Association was spending money against him because he's very much opposed to a lot of what hospitals stand for various reasons. So logically, if the Missouri Hospital Association comes down and puts pressure on somebody like that, he's going to tell him to take a hike because he was actively being challenged by them. I don't know if there are many comparable examples to that, but there are certainly legislators who see these interest groups as not effective or not powerful because they've been adversarial against them in the past.
Speaker of the House has said we're going to look for innovative solutions. We don't consider this free money. We don't like it, but we will study this and look for innovative solutions. Is that a serious effort moving ahead, or is it a way to reframe this issue in a way that maybe some things could get done?
Well, they haven't outlined what those would look like, what those innovations would look like. The Democrats are contending what Nixon is contending is that, this isn't something that the state will have to pay for, it's something that the federal government is paying for, but they're only paying it for 3 years, which is what House Speaker Tim Jones has been saying. And he's been saying that after those 3 years, then who's going to be paying for it? It's going to be turned over piecemeal over to the state government, and where's that money going to be coming from? So they're saying that it's not free money technically because their contention would be that there's no such thing as a free lunch.
Do you get a sense that among those who are still adamantly opposed to Obamacare, that there's a sense that if states refuse to go along with this, Texas included, that it will force the government to negotiate, to issue waivers, to do some things that so far the administration says it's not willing
I
to
have
do?
heard that argument before. It really is going to depend on if a lot of states decide to make that decision. I think recently this month, Arizona's governor, who's a
That's right.
Republican,
Jan Brewer,
I believe-
outspoken Republican.
I believe
Very
announced that
conservative.
she was going to take
Right.
the Medicaid expansion. Maybe not her personally. I guess you personally as a governor don't grab the Medicaid expansion and sprinkle it over your state. But I mean, it's still important because as is a separation of powers issue. And you may see more governors do that when the writing is on the wall in a lot of the states with Democratic governors and Democratic legislatures accept the Medicaid So I mean, it's really too soon to tell, but I have heard that argument before.
Well, because in some cases it depends on what the public does. In some states, let's say Florida, for example, Phil Scott, who's the Republican governor, has been hammered for a couple of years. Rick Scott has been hammered for a couple of years over various issues. He knows a lot about he comes from the healthcare industry. He's been sort of changing his tune a bit on the expansion. He hasn't said he's going to take the money, but there's a lot of focus on whether or not there might be an effort to at least take some of it. Well, it's because they're getting a lot of pressure from many of the residents of that state, particularly since Florida's been hit hard by the recession, by the housing boom bust, and a lot of other things. So a lot of these states, it's going to depend on the climate in their state and how that's going to affect things. And like in Illinois, they are going to take it for sure. Kansas, I think they're saying they're not, but Arkansas to our south, it looks like they may. Iowa will probably take it. So I think there's going to be a lot of impact from what happens around us. And again, like I said, I really think that the biggest determiner is going to be what happens in rural Missouri. If hospitals start closing, if things start happening where people really get upset, then you might see legislators, because most of the rural legislators in Missouri are Republicans, then you might see them giving another look at it. But in the meantime, philosophy is important here.
And I want to clarify, and going back, this is not something that is going to be necessarily proposed in the legislature, passed and vetoed. We're not really dealing with a veto-proof majority because it's not going to get to the point.
That's right. That's right.
This is really a question of not doing something as opposed to passing something.
Correct.
But just to jump on one of Joe's points for a second, I mean, we can talk about the political calculations as much because we're political reporters and political animals, but this is going to be a decision that affects real people. I mean, if somebody is making that little amount of money that Chris mentioned, they're not going to be able to buy money on these health insurance exchanges. So if the expansion doesn't happen, they'll still probably go to the emergency rooms to get care, but that's going to cost money, and it's going to affect whether people go to get health care or not. So that's not a reason to do it or not do it, but that's going to be a consequence of doing it. Now, another consequence that Republicans are putting forward is how you pay for that, and I think that is just as much of a burning question as what happens if it doesn't happen.
And not just how does the state pay for its share after the first 3 years or by 2020, but whether the federal government's going to keep its part of the deal.
Correct. But, and the way the formula works, actually, the state of Missouri's share would actually be lower than the 10% because a portion of that 10% actually would come from hospitals. So what the state budget director has been telling me that they're estimated to be somewhere between, as far as the state's actual share, somewhere around 100 million to maybe 200 million, which is a fraction when you're talking about a state budget that just of general revenue is roughly around $8 billion a year. So that's just a fraction of that. But again, while everyone talks about the money, really, a lot of this is about philosophy. There is a belief that even if it is free, even if it doesn't cost the state anything, that the state shouldn't be doing it. That's where some Republicans are coming from, because their belief is that this should be private, and it should be the free market, and the state shouldn't be involved.
Well, thanks for joining us, guys. It's the Beyond November political reporting team, Jason Rosenbaum, Joan Manis, and Chris McDaniel. Thanks for helping us understand this.